Thank you all so much, and apologies for the technical difficulties. We're working on these as we speak. Right now, we are transitioning to the second part of the Emo Bridges session for some new programming that we have this year, where we've been trying to innovate on the conference structure with what we're calling the social hackathon, where we've had teams that we've created a theme, in this case being breast cancer and environmental risk factors. It's all been spearheaded by Dr. Jacqueline Calderon from UASLP, where she's provided a data set with, curated a data set with environmental risk factors and breast cancer incidents, and multiple teams from around the world have sent propositions of tools that are meant to help policymakers with their decision points with breast cancer in Mexico and beyond. And so I want to kick off these last 45 minutes by first of all thanking our jury members who are going to help us decide amongst our 4 finalist teams who will be the winner of the hackathon. And our jury members are Dr. Daniela Costa Diaz de León, from Director of IMSS Bienestar. Thank you so much. We have Maestra Jessica Albarrán Ramírez from the Municipality of the DIF, the Director. Thank you so much for being here. And of course, Dr. Jacqueline Calderon, with whom this would not at all be possible. Thank you so much. We have Professor Brian Wilder from Carnegie Mellon University. Thank you for being here. And Dr. Daniel Salgado from the Centro de Supercómputo y PICIT. Thank you so much. And so first, we're permuting our order of presentations a little bit due to the technical difficulties. But our first team is going to be ALMA, which is local help for women with an, I'll say it in Spanish actually, Apoyo Local para Mujeres con Análisis, a platform for early diagnosis and improved access to screening and treatment in underserved areas for breast cancer. So please, I'd like to welcome them to the podium, and then we'll get your slides ready for presentation. The mouse is doing weird things again. Do any of you guys know how to fix this mouse issue with Macs, where like it clicks other places?
Not that sure.
The mouse is doing weird stuff.
We can go to the internet and we can log in, if that works.
There's no internet, sorry, I'm gonna have to restart this. We had this issue earlier. Sorry about that.
No, you're sorry.
Maybe you guys can introduce yourselves in the meanwhile.
Hello, everyone. We're Team ALMA. We're a collection of students from different universities. My name is Cody. I'm a 4th year studying molecular and cellular biology at Harvard University, and it's a pleasure meeting you all.
Hello, my name's Kobe, and yeah, Kobe, and I'm also a 4th year student at Harvard studying bioengineering, and I'm excited to be presenting our research to you guys.
Hi, my name is Kushi. Thank you so much for coming out. I'm also a student at Harvard with these two, and I'm studying molecular and cellular biology. Super excited to meet you all today. Thank you again.
Hello, my name is Joaquin Alvarez. I'm from ITAM in Mexico City. Just finished my bachelor's degree in applied mathematics. And thank you all for having us here.
Hello, everyone. Sorry for the technical difficulties. But again, we are Team ALMA, a collection of students from different universities, and we are here to present a public health challenge that is almost 30% of all female malignancies in Mexico are related to breast cancer. And this could be an interplay of many different factors, such as socioeconomic status, healthcare access, or environmental factors. However, a lot of evidence, emerging evidence, have shown that only 1/3 of breast cancer cases in Mexico can be prevented through lifestyle modifications. And there is a strong linkage between breast cancer rates and air pollution. So there is a great need for innovative approaches to inform evidence-based decisions and improve outcomes. And our project ALMA is addressing that. We are developing a mobile app to improve early breast cancer diagnosis and access to screening. And we have utilized a comprehensive data set from the EMO Social Hackathon to conduct a three-part analysis. First is an exploratory data analysis to identify key patterns and trends. Second is a linear regression model to quantify the impact of different factors on breast cancer mortality. And lastly, a random forest model to predict individual risk levels. And our ultimate goal is to inform targeted interventions and improve breast cancer management.
So we first began focusing on a brief exploratory data analysis. I won't cover it too exhaustively, but we found this sort of bell-shaped distribution in the age of the women who die from breast cancer, mainly concentrated around 35 years old and 75 years old. And here you can see like some bar plots that are labeled, one for urban death cases and two for rural cases. And this historical increasing trend, something that we want to highlight here is that we encountered a variety of challenges to try to bridge this data set into some useful model that we can extract insights from. Mainly because we believe that there are some important confounding factors that we should take into account for. So for example, like the very thing that motivated this project, the hackathon, which is like lack of measurements and equipment to diagnose and to screen and treat breast cancer people, which might be explaining like this sort of imbalance between rural and urban cases. And our first approach was like performing a linear regression. I won't cover it too exhaustively, but we found like lots of challenges that made it hard to fit this kind of model into the data set, mainly because this model requires like lots of assumptions, like you need to be aware of multicollinearity issues between variables, also assuming homocelasticity, and like lots of assumptions that were like really hard to fit. So like the bottom line was that we needed like a little bit more flexible and robust model, which Kobe is going to cover.
So because of the challenges associated with the linear regression, which we originally were going to use to predict breast cancer death rates in municipalities across Mexico, we actually opted to use a random forest risk assessment tool to categorize women into high, medium, and low risk groups for a survey that we were going to implement in the application of ALMA. And so here we have the data from the random forest risk assessment tool, and our table to the right shows when we tested the model, and we have actual breast risk groups and then the predicted breast risk groups. We found that our assessment tool has a 98% accuracy in determining whether a woman whether a woman is highly susceptible or highly susceptible, medium susceptible, or low susceptible to developing breast cancer, depending on these measurements that we had in the measurements that we had in the data set. Another important aspect that we found in the linear regression was that a lot of these factors only applied to 2 states in Mexico, Zacatecas and San Luis Potosí, because there was a lot of data missing in certain states about air emissions or soil carcinogens. And so that's another important factor that we considered when developing our kind of prototype understanding of how our application would work. And so we kind of have like a prototype of how we envision our application working. And so we want to introduce ALMA, Apoyo Local para Mujeres con Análisis. A broader kind of interpretation of what we would like this app to be is just helping women analyze their risk for kind of any sort of disease or condition. But for the purpose of this hackathon, we really wanted to stick to the analysis of breast cancer susceptibility. So when you would open the app, you would first be introduced to just kind of a user interface that would be like, hello, user, can you kind of fill out this survey? And then if the user didn't want to fill out this survey, they would just have like general resources general resources about breast cancer in general. In filling out the survey, they'd be asked questions like, oh, how much firewood do you use to cook on a daily basis? Because we found in our data set that higher usage of firewood, it leads to higher risk of developing breast cancer. And so the user would have the option to choose how common they use firewood, and at the bottom we also have the option for them to understand why we are asking this question in the survey. We would have other questions that would ask them where do they live, and this will help us determine if they live near a factory, if they live near a source of water pollution, a source of soil pollution. And again, we ask them at the bottom why we are asking, or we have the option, they have the option to select why they are being asked this question. And so when they finish the survey, they are given a medium risk, a high risk, or a low risk assessment using our random forest model that we talked about previously. And then they would be personalized feedback. For example, the first one says you live near a factory. What are the benefits of wearing a mask? The second one is like, you may live near this supermarket. What are some healthy options that this supermarket has? The last one is just like how to incorporate exercise into your daily life. And we intend these options to be very specific to the user. Another thing that we found is kind of based on other very successful applications that help users stay attached to their goals, such as Duolingo. We have this like trajectory plan to help women stay on task of preventing higher risk assessments of breast cancer by using certain targets. And so we have this like prototype of like a little journey game that women can take. And we also, yeah, and then just here at the bottom, we just have some more kind of ideas floating around with the app of like having women support groups or support groups in general, women being able to track their assessment, news about research that's upcoming in breast cancer. And so this is kind of our vision for what we have for our app.
So an important question that a lot of people might be asking is how exactly would we measure the impact of our application? And we have two particular avenues for this. One, integrating this with local healthcare partners, so implementing this part of like hospitals and clinics, and tracking the number of healthcare providers using this app before and after, and also monitoring the frequency of app users during consultations. Our second avenue is implementing this within the community, so implementing this through a community health worker programs. And this can take a form of measuring the number of women reached and also subsequent screening rates, and also tracking changes in breast cancer health awareness and promoting testing. But through these two avenues, we plan to change and also implement the kind of the healthcare aspect of Mexico.
All right, so finally, we'd love to talk a little bit about how our findings can be used to shape health policy in SLP and in Mexico more broadly going forward. So we want to explore three key areas, the first being using our findings to inform how we can clear the air through environmental regulations. Secondly, we want to talk about how we can strengthen access to care through strategic resource distribution. And finally, we'd like to talk about how we can use our findings to empower communities through education. So first of all, we want to propose a policy solution that entails air pollution public health alert systems. So ideally, this kind of system would inform people in SLP when the air carcinogen levels are very high, and would also provide education to the public on what kinds of factors, what kinds of steps they can take to mitigate their exposure and risk. Ideally, these kinds of interventions would improve air quality and public health outcomes. And we did some research on other case studies and found that, in Santiago, Chile, a very similar intervention was very successful. It reduced air particulate matter by 20% and also reduced mortality among older individuals. And then in South Korea, a similar system actually led to $7 in healthcare expenditure savings per $1 invested, showing that this kind of system could be really effective and cost effective. Shifting gears, we'd also like to talk about how our findings can be used to inform healthcare resource distribution. So we think that our analysis kind of told us which kind of states in Mexico have the highest air carcinogen emissions. And these states are Mexico, Querétaro, and Tabasco. And so using this information, we think that we could prioritize routes, mobile clinic routes, to high-risk, high-burden areas and leverage the existing mobile clinic infrastructure that's already in place in Mexico. A similar system in Cairo actually optimized emergency response times by 22%, and they considered factors such as condition risk and road conditions, and so we'd love to implement something like this in SLP. Finally, we want to talk about how we can use our findings to enhance health education and health information more broadly in SLP through a train-the-trainer approach. So essentially, this approach involves, training a bunch of community leaders within the SLP community, including community workers, religious leaders, traditional healers, in important topic areas such as reducing stigma, healthy cooking, and self-examinations for breast cancer. Then going forward, these trainers could train other community members who could train other community members and so forth. And because we're kind of relying on the community, the system is very cost effective and self-sustaining. Now, in other contexts, for example, in Nigeria, they implemented a similar train-the-trainer approach, and it had a lot of positive effects. It increased a lot of different health-seeking behaviors, and it only costed $25 to $50 per maternal infant death prevented, showing that it's very impactful and also very cost-effective to implement. So yeah, thank you so much. These are 3 of our policy solutions that we want to recommend. We hope that through our research, through our app, and through these policy-level solutions, we can contribute to improving health both in the SLP for individuals and the community at large. Thank you so much.